What do you know about aspirin? Neighbors take it, doctors advise it, and TV assures that it gives you time for a long and happy life. Many patients are convinced that absolutely everyone 45 years old and older needs to take aspirin. But is it really so? I'm here to answer your question. Alright, doc, who among those with hypertension needs to take aspirin all the time? First of all, this applies to those who have had a stroke or heart attack in the past, as well as transient cerebral circulatory disorders. In each case, the benefit of taking a prophylactic dose of aspirin must be adequately assessed and must be greater than the risk of developing a possible bleeding disorders. Then who among those suffering from hypertension is not recommended to take aspirin? All those who have no history of stroke, heart attack, or other cardiovascular disease other than hypertension. For today, there is no evidence base for prescribing aspirin in this type of clinical situation. And should aspirin be taken by those who suffer from hypertension combined with diabetes mellitus? In this case, in the absence of other cardiovascular diseases, it is not necessary to take aspirin to prevent stroke and heart attack. Why? Because the constant use of aspirin by patients suffering from hypertension and diabetes is quite often accompanied by the development of bleeding, like gastrointestinal, nasal, and hemorrhoidal. In this case, the risk of life-threatening complications will exceed the benefits of treatment with the drug. Can aspirin be taken during a hypertensive crisis with high blood pressure? Of course not. In this case, taking aspirin can provoke the development of a brain hemorrhage. Persons suffering from hypertension can take aspirin only when adequate control of blood pressure has been achieved. In other words, when hypertension is under control. Don't forget this. And of course, never forget to consult your doctor before taking any medications. Hope my advice will help you be healthy, dear friends. See you soon. Yours, Natalia, and Allright, doc.